Hello everyone, and welcome to another edition of For the Health of It. I'm Lou Beccaria, your host. Glad to have you with us once again. The topic of our show today is emergency medicine. We all know that in order to have a truly healthy community, we need a good emergency healthcare operation at our local hospital. Well, we're very lucky. We have that here in Phoenixville at our Phoenixville Hospital. The emergency operation at the hospital is one of the very best around in our general region. And here to tell us about emergency medicine and how it's practiced at the hospital is Dr. Neil Gulati, the hospital's chief of emergency medicine. Dr. Gulati, welcome to the show. Thanks for being with us.
Thank you very much. It's my pleasure.
So let's start off by, introducing you to the public, because I know you're new to the community. Tell us a little bit about your background.
So I'm from Bucks County. I went to Pennsbury High School, and then I went to Penn State University main campus for undergrad. After that, Temple Medical School. Then I had to get outside of Pennsylvania, so I went to Georgetown for my residency in Washington, D.C. My wife and I, we were starting a family, so we decided to move back, and that's when we came to Reading Hospital and became part of Tower Health. Been there for 10 years and transitioned over to Phoenixville.
Oh, great. Well, that's a great background, and certainly those schools you went to were terrific. In your practice of medicine, how did you decide upon emergency medicine as your specialty?
It's kind of interesting. So initially when I was in medical school, I always thought I would go into OBGYN. I think growing up, watching The Cosby Show, I was always very into wanting to become like a baby doctor. However, going through medical school, I realized emergency medicine kind of fit. You kind of need to be able to multitask very good and be procedurally oriented. And I think those are qualities that I have, and so that's kind of why I went to emergency medicine.
Yeah. Is having a little flair for excitement part of why people are attracted to emergency medicine? Because there's a lot of stuff happening at one time, and you see many different things in the course of one shift.
Yeah, part of that is true, but I would say contrary to popular opinion, it's very mundane. A lot of what we see is routine. We occasionally get the exciting, trauma or heart attack coming through, but it's usually routine patient care. But it's a lot of balancing. We got to be able to multitask. That's the biggest thing.
Yeah. So how many people are part of your emergency medicine team at the Phoenixville Hospital? Who is the staff that make up the emergency room?
So there's multiple doctors. There's probably about 8 or 10 that rotate through. We also have physician assistants or advanced practitioners who help and also see patients. Then there's a multitude of nurses and technicians, PCAs. We also have EKG techs and transporters and radiology techs that come and assist. So it's a very large team that provide care.
And so what is your particular role, doctor?
So my role as chief, it's mainly I do a lot of the administrative background. So I do the scheduling, deal with all the other issues that may arise, the non-clinical work. In addition, I see patients too. That seems to be what most doctors want to do, is to see patients and treat people. That's why we went into medicine in the first place.
Sure. So in a sense, you're kind of like the medical orchestra leader, in that you've got a whole team and you've got to make them make good music, so to speak.
As somebody put it to me, it's almost like a camp counselor. You're in charge of like a bunk, and you kind of got to direct people and sometimes put them in line.
Yeah. So describe what an actual physician does on his or her shift. Just kind of wait around for people to come in, or it's more complicated than that?
So usually, it's a little bit more complicated than that, but yeah, in essence, we're open 24/7, 365, so patients come in kind of whenever. A lot of times it's hard to predict. There are certain days of the week it's busier. For example, Mondays are usually busier.
Why is it on Mondays?
So I think most people prefer to wait through the weekend. A lot of times we get people on Monday saying they've had symptoms ongoing for days. I think if you had a preference, you'd rather not miss your family time, your personal time to come in. So people push everything to Monday.
So you get off work.
It's part of it,
Part of it.
but part of it, I think a lot of it really has to do with, especially with elderly, they want to be with their family through the weekend, or maybe grandma might not have seen her family, and then all of a sudden family shows up on the weekend, and they're like,
Yeah.
you're not acting right, and then let's go to the ER.
So, speaking about older people, do you tend to see more older people than younger people?
Yeah, for sure. Usually the younger people tend to be your traumas, your accidents, trips and falls, and that sort of thing. And the elderly tend to be the sick patients.
Okay. What kind of sickness do they normally present to you
So
with the older people?
a lot of the complaints we get are chest pain, belly pain, headaches, aches and sprains. Elderly also could be septic, have infectious causes,
Yeah.
other symptoms. So definitely, I think the elderly population should be coming to an emergency department as opposed to going to an urgent care setting.
Okay. Because there's more comprehensive capability there?
Yeah, we have all the testing, and we have the ability to contact specialists and get patients admitted to the hospital. Every single day we see patients getting transferred from urgent care to our emergency department.
Yeah. One of the aspects of the care you provide there, you were just mentioning with older people, stomach pain. What are I'll just pick that one out at random. What are some of the reasons somebody who's older, a senior citizen, could be having stomach pain?
Usually we try to keep in our differential diagnosis like a pretty vast differential. So an elderly patient with belly pain, could be anything from as simple as constipation to something more serious like an appendicitis, peptic ulcer disease, pancreatitis, gallbladder disease. So usually we got to, in addition to our history and physical exam, we do diagnostic testing, which could include lab testing, urinalysis, X-rays, CAT scans, ultrasound. So we have the ability to do that in our emergency department.
Mm-hmm. That's very instructive, and one of the things we're trying to do on the show is actually inform people. So that's very, very good that you did that. Healthcare insurance. Do you find that people are coming to the emergency room because they don't have health insurance, or how does all that work with the insurance?
I think that's a great question. I would say on the clinical side, that's something we don't even look at. In the emergency department, we treat all comers. Whether you have insurance, you don't have insurance, our goal is to treat everybody the same and do all the workups the same. There might be something to that with lack of insurance driving people to the emergency department, right, because they tend to not have primary care physicians.
Yeah, okay. Doc, we're going to have to take a break now for commercial, pay the bills. So you stay by. And folks, we're going to take a break for commercial and hear from the Phoenixville Hospital Tower Health and the Phoenixville Community Health Foundation. So please stay with us, and when we come back, we'll hear more from Dr. Neil Gulati. Stay with us. Hello, everyone, and welcome back to For the Health of It. For those of you who are just tuning in, we have the pleasure today of talking with Dr. Neil Gulati, who is the Chief of Emergency Medicine at the Phoenixville Hospital Tower Health. When we left for commercial, Doctor, we were talking about the kind of the demographics of people. And for the benefit of our viewers, it doesn't matter, in serving people in the emergency room, it doesn't matter your economic status, whether you have insurance or not. Also, does it matter if you're documented or undocumented?
Yeah, we treat all comers equally, regardless of race, religion, whatever it may be. If immigrant, non-immigrant, we treat everybody the same. We give everybody the workup that they need, that the physician thinks they need, and we go from there.
Yeah. So I guess that's part of the Hippocratic Oath that you take, is to treat everybody.
Treat everybody no matter what. Yeah.
Yeah. Well, let's go into training a little bit, Doctor. What kind of training, ongoing training, do the staff, the different members of the staff of the emergency department, what kind of training do they need? And the second part of the question is the emergency medicine department accredited? Does it have to be accredited? And what do you have to go through to be accredited?
So now at Phoenixville Emergency Department, every physician is board certified in emergency medicine. And there is a process. You have to sit for your boards. You have to maintain board certification status by having continued medical education credits. Every 2 years, we have to have 100 credits. In addition, we have to take tests every year and have a certifying exam every 10 years to maintain our board certification. So it's pretty rigorous. There's a lot of hoops to jump through to maintain that board certification.
Is there more certification for the individual doctors and other people who compose the team than, say, other disciplines, other specialties in the hospital?
Yeah, I think it's probably different certification. Each specialty has its own type of certification. For example, internal medicine and surgery have different certification than emergency medicine. I'd like to point out that at Phoenixville Emergency Department, we're all board certified in emergency medicine, but if you go to an urgent care, they tend not to have board certified emergency medicine physicians. They tend to have family physicians. So the way I like to think of an urgent care is kind of, if you want to go see your family doc but you can't get in, you could go to an urgent care. But if you actually have something that you think is an emergency, you need to come to the emergency department.
Okay. Well, that's a good distinction. And I guess thank God that the urgent care centers are there, but and thank God you're there for the more serious things. Okay, so what types of conditions do you normally treat, Dr. Gulati, at the hospital?
Typical complaints we get are chest pain, belly pain, headaches, some minor trauma, trips and falls, sprains and strains, those kind of things are typical that patients come in with, and infection.
Over the years that I've been with the Phoenixville Community Health Foundation, I've gotten pretty involved with mental health issues. And do you see much of that? And is there a way that you deal with that? Because I've heard of, in the past at least, that some people who present themselves to the emergency room may be acting out from either drugs or from a mental health condition. And how do you deal with all that?
Those patients tend to be challenging. We do see mental health patients. We do see drug and alcohol patients. We have social work and case management that work with these patients, try to get them placed into the appropriate facilities to get the appropriate treatment that they need.
In the mental health field, there is a kind of a specialty called mental health peer specialist. A mental health peer specialist is someone who has in the past had mental health issues. They have overcome them and have gone through specialized peer specialist training. Around the country, some hospitals are actually employing them to be in an emergency room to help settle down, if you will, for want of a better term, people who are presenting with mental health issues so that they can relate to that person in a peer-to-peer way. Do you feel that there would be value of having something like that at the Phoenixville Hospital? It would make your job probably easier, but even more importantly, probably would be helpful to the person who's experiencing the episodes.
I totally agree. I think that would be something that would be of value added to the department. We have something similar to that where I came from at Reading, and it would be nice to be able to start something similar here at Phoenixville.
At Reading. That's good to know. That's great. So what percentage of patients who present themselves to the emergency room, I guess I'm using the old term emergency room rather than emergency department, but present themselves via ambulance?
Yeah, I think it's somewhere around 20-ish% come in by ambulance. The majority of our patients are actually ambulatory and walk in. So our association with EMS works. We work together in a very collegial fashion. They usually call ahead with their patient, kind of give us a little, so we could mini triage them, get them into the appropriate room that they need to be in, and get the appropriate resources ready for when they arrive.
The matter of security, is there security in the emergency department just as a general means of making people feel secure in case something aberrant should happen?
So there is security around and available in the hospital that we can call down to the emergency department if needed.
Okay, good. All right, we're going to take another break. Folks, please stay with us. We have more with Dr. Neil Gulati, who is the Chief of Emergency Medicine at the Phoenixville Hospital. We have more questions to ask him, and he has more information for you. Stay with us, and we'll be right back. Welcome back, everyone, to For the Health of It. For those of you who are just tuning in, we have the pleasure today of talking with Dr. Neil Gulati, who is the Chief of Emergency Medicine at the Phoenixville Hospital Tower Health. And continuing on, I'd like to ask you, how has emergency medicine, doctor, changed over the last, say, 5, 10, 15 years?
I think it's grown to the point where most emergency departments are having board-certified emergency physicians. And that's important because not only are the care that's provided is better than what it's been like 10, 15, 20 years ago, it's important because we're able to deal with a multitude of problems and kind of save those specialists from having to come in and deal with them. And then we're able to transition care and pass them off to those specialists.
Okay, great. Another question I'd like to ask you is about Tower Health and the Phoenixville Hospital Tower Health's commitment to timely and efficient care. I see commercials on television, actually, about, you can be seen in 30 minutes, okay? And so maybe there's other aspects of that as well. If you could go into that a little bit.
So some of those advertisements for the 30 minutes or less guarantee could be a little bit misleading because the provider just comes in and says hello, and that counts towards that guarantee. So I like to think of it that we try to provide the best care possible as timely as we can. When we come in to talk to a patient that arrives, we like to take our time and really try to figure out what's going on, order the appropriate tests, order the appropriate treatments to get to the diagnosis and to provide pain relief, for example.
Okay. Given the fact that people who come into the emergency department are in some degree of anxiety because of the condition that they may have or may not have, is there training, along with the medical training, is there, I'll call it interpersonal training for the doctors and the other team members to help put people at ease and maybe even have humor in it a little bit?
I think you bring up a great point that in short, no, there's no specific training, but I think you bring up a great point that you definitely, to be a successful physician, taking care of patients, that you need to have that type of skill to be able to relate to patients and talk to them like they're people. Because in the end, we're all people, and you got to put patients at ease and make them feel safe and secure, and like they're getting good care.
Yeah. Well, it sounds from your answer that that's a priority for you, and you'll be pushing that with your team.
For sure.
Separate area for seniors. It was my understanding. I got this understanding somewhere that in the emergency department there's a separate area for seniors. Could you talk to us a little bit about that?
So we do. We call it our senior observation unit or a geriatric observation unit, and so it's not specifically in the emergency department. However, when certain geriatric patients are admitted to the hospital, there's a specialized unit just for them to have specialized geriatric care.
Okay, good.
And it's right adjacent to the emergency department.
Yeah. Tell us a little bit about any dangerous situations that you may have encountered, not just at the Phoenixville Hospital, but in your overall practice, in your career of emergency medicine.
So usually the dangerous situations arise from patients from drug and alcohol or mental health. Those are typically the ones. Probably every healthcare worker could tell you in the emergency department that they've been either slapped or attacked or spit on by patients, verbally assaulted, I've been called all kinds of names, but they're usually patients who are intoxicated or on drugs or have suffering from a mental health disorder. Although the only time I've ever been hit was by an elderly patient with dementia.
Oh, really?
So.
Okay, well, that's interesting. along with this, I mean, is there training about kind of how to defend yourself?
So there's no real specific training. We may take some courses here and there that might talk about it for a short period of time, but no specific training. Usually we try to call security, and they do tell us during our psychiatric rotations in med school that, try to stand by the door so you could get out if you need to call for help.
Okay, great. Well, we got time for one more question. Are there any typical situations that you see? What are the typical ones that kind of come through the door?
Probably most typical are patients in pain, a variety of pain, chest pain, belly pain. They might have fell and hurt themselves. So we really try to put those patients at ease, treat their pain appropriately, and do the appropriate testing.
Okay, great. Well, that's all we have time for. I wish we had more time, Dr. Gulati, and thanks very much for taking time out of your practice to be with us. So it's been great having you as a guest.
It was a pleasure. Thank you so much.
You're welcome. Ladies and gentlemen, that's about it for the show today. Our thanks to Dr. Neil Gulati for the fine information that he's imparted to us about emergency medicine at the Phoenixville Hospital. And remember, folks, as I always like to say, if you're healthy, you're wealthy. I'll see you next time. I'm Lou Beccaria.